What if your heart wasn't on the left side of your chest? For most people, the heart is located slightly toward the left side. But in a rare condition called dextrocardia, the heart points toward the right side of the chest. And here's the surprising part. Some people with dextrocardia may have few or no heart-related symptoms at all. So how does this happen, and does having your heart on the right side mean something is wrong? Let's find out. Welcome back to Heart Lifelines. Today, we're exploring dextrocardia, a rare condition in which the heart develops in a position where its main point, or apex, faces toward the right side of the chest. We'll explain what causes it, the different ways it can occur, possible symptoms, how doctors discover it, and when treatment may be necessary. What is dextrocardia? Normally, the heart sits in the middle of the chest with most of it extending toward the left side. In dextrocardia, the heart develops with its apex pointing toward the right side. This happens during development before birth. Dextrocardia itself is not necessarily a disease that causes problems. Some people have dextrocardia with an otherwise relatively normal heart structure. However, in other people, dextrocardia can occur together with congenital heart defects or with an unusual arrangement of other organs. This means that simply knowing the heart is on the right isn't enough. Doctors also need to understand how the rest of the heart and body are arranged. How does it happen? Dextrocardia develops while the baby's heart is forming in the womb. During early development, the heart starts as a simple tube. It then bends, twists, and changes shape to eventually form the four-chambered heart. If this process occurs differently, the heart can develop with its apex pointing toward the right instead of the left. Sometimes, the heart is the only organ with an unusual position. In other cases, the organs throughout the chest and abdomen may also have an unusual left-right arrangement. This is where conditions such as situs inversus or heterotaxa can become relevant. Dextrocardia versus situs inversus. These terms can sound confusing, so let's make them simple. Dextrocardia specifically refers to the heart's position and orientation, particularly its apex pointing toward the right. Situs inversus, on the other hand, refers to a mirror image arrangement of internal organs. A person can have dextrocardia with or without situs inversus. For example, someone could have their heart on the right while other organs remain in their usual positions. In other people, several organs may be arranged in a mirror image pattern. And then there's heterotaxa, where organs may have a more complex or mixed arrangement. These differences matter because they can affect how the heart and other organs function. Does dextrocardia cause symptoms? Here's something important. Dextrocardia itself may not cause symptoms. Some people may live their entire lives without knowing they have it. It might be discovered accidentally during a chest X-ray, ECG, ultrasound, CT scan, or another medical examination. However, symptoms can occur when dextrocardia is associated with other congenital heart defects. Depending on the underlying condition, someone might experience shortness of breath, abnormal heart rhythms, low oxygen levels, fatigue, or other symptoms related to the associated heart or organ abnormalities. So the symptoms depend largely on what else is happening with the heart. How is it diagnosed? Doctors can use several tests to identify dextrocardia and understand the heart's anatomy. A chest X-ray may reveal that the heart is positioned toward the right. An ECG can also provide important clues, but the electrode placement and interpretation may need special consideration. An echocardiogram can create moving images of the heart and examine its chambers and valves. Doctors may also use CT scans or cardiac MRI to get detailed pictures of the heart and surrounding organs. These tests help doctors determine whether dextrocardia is isolated or associated with other structural abnormalities. Does it need treatment? So, does someone with dextrocardia automatically need treatment? No. If the heart is functioning normally and there are no significant associated problems, treatment may not be necessary. Instead, doctors may simply monitor the person's heart health. If dextrocardia occurs alongside a congenital heart defect, treatment is directed toward that specific problem. Depending on the condition, treatment could include medications, catheter-based procedures, surgery, or monitoring. The important thing is understanding the individual's unique heart anatomy. So, can your heart really be on the right side? Yes. Dextrocardia is a fascinating example of how the human body can develop differently while still functioning normally in some people. And it reminds us that where the heart is located isn't the only thing that matters, it's how the heart is structured and how well it functions. Thank you for watching Heart Lifelines. We'll see you in the next video.